Good afternoon, everyone, and bonjour à toutes et à tous. I'm really happy to provide a few remarks at the start of your meeting. Before I begin, I would like to acknowledge that I am speaking to you from the traditional unceded territory of the Algonquin and Anishinaabe people. Les peuples autochtones vivant partout au Canada ont fait preuve d'un leadership et d'un esprit de collaboration communautaire exceptionnel en réponse à la pandémie de COVID-19. Over my career, and especially my tenure as Canada's Chief Public Health Officer, I've had the privilege of talking to many Indigenous leaders. One thing I've really come to appreciate is that we are, in fact, united in visioning a better future for all. We can all learn from each other by listening and working together to benefit all people living in Canada. I want to begin by expressing my gratitude to today's organizers and to participants of this summit. It is through the leadership and advocacy efforts of the HIV community in Canada, including many of you who are participating today, that work on episodic disabilities found its footing. I applaud your ongoing commitment and dedication to this work. I look forward to hearing how the lessons learned and insights you have gained through your work on HIV can be applied to the emerging issue of post-COVID-19 condition, or as it's more commonly known, long COVID. It will be a challenge for all of us, including for people with chronic conditions, such as people living with HIV. Today, I plan to share with you my thoughts on the pandemic, the emergence of post-COVID-19 condition, and some of the activities taking place that will help us to better understand and ultimately address this condition. We have all been forced to adapt over the past 2 years to respond to the COVID-19 pandemic and its impacts. Among the many lessons of the pandemic, the past 2 years have shone a light on the need to address the social determinants of health and provide all those living in Canada with equitable access to public health and healthcare services. Parmi les nombreuses leçons tirées de la pandémie, les 2 dernières années ont mis en lumière la nécessité de tenir compte des déterminants sociaux de la santé et de fournir à tous ceux qui vivent au Canada un accès équitable aux services de santé publique et de la santé. I am pleased to see the summit agenda that will be conversations on the intersections of identities in the lives of people with episodic disabilities. Many of you know that issues of health inequities is something that I am passionate about addressing. Right now, we are in a period of transition, moving away from the crisis phase of the pandemic. But the virus has not disappeared. The impacts of the COVID-19 and the impacts of our response will linger. On a societal level, the economic and social impacts will also persist. While uncertainties remain in how the trajectory and the virus itself might evolve going forward, we have more tools to address COVID-19 and new innovations are being developed on an ongoing basis. The transition period is a period of preparedness and readiness to respond to emerging variants, but also one of recovery. Unfortunately for some, recovery from COVID-19 will be a difficult journey. This is the case not only for those with post-COVID-19 condition or long COVID, but also for those affected by missed medical appointments, surgeries, and access to health promotion, prevention, harm reduction, and other support services. I know that this audience has had their own experiences with this. You are either impacted personally, or you or your organizations support people and communities who are. We have a lot of work to do, but we mustn't lose hope. Comme nous l'avons vu dans notre réponse à la pandémie, une innovation incroyable est possible lorsque nous travaillons ensemble. Et je crois que ce sera le cas pour la COVID-19 pendant longtemps. Since early 2020, the Public Health Agency of Canada, alongside our provincial and territorial counterparts, have been working with experts, nationally and internationally, to advance the evidence and knowledge base to support those experiencing long-term effects of COVID-19. We're also engaging with patients, and I want you to know that we really value your input and hearing your experiences. In 2021, the Public Health Agency convened a panel of individuals living with post-COVID-19 condition. Their contributions to date have already helped to inform various Public Health Agency of Canada-led initiatives, such as informing the development of web content on long COVID and the selection of priority topics for the review and analysis of international scientific literature. By understanding the patient perspective and hearing their stories, we can better shape our programs and initiatives to reflect the needs of those with long COVID. Today, I want to outline that while there is a lot of work ongoing in different areas of long COVID, there are still knowledge gaps in which we hope to learn more. I know that some people have been experiencing difficulties associated with long COVID for quite some time, some for almost 2 years, and yet many things remain unknown and unclear. The health science community, led by the World Health Organization, has developed a standard method of describing and classifying post-COVID-19 condition. Post-COVID-19 condition occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of COVID-19, with symptoms that last for at least 2 months that cannot be explained by an alternative diagnosis. Symptoms may be new onset, following initial recovery from an acute COVID-19 infection, or persist from the initial illness. Symptoms may also fluctuate or relapse over time. The clinical case definition developed by the World Health Organization is important so that we can better measure how frequently long COVID may occur and its variability across populations. We know that post-COVID-19 condition is real, and the proportion of Canadians who are long haulers living with this is concerning. Many studies are attempting to estimate the proportion of people with COVID-19 who go on to develop post-COVID-19 condition. But what we don't know with certainty is the frequency with which it occurs. Studies have shown variability in estimates of how many people are affected by post-COVID-19 condition. For example, early synthesis of findings from multiple studies cited by the WHO suggested up to 1 in 5 people who had COVID-19 go on to develop post-COVID-19 condition. How does this apply to Canada? A recent study from Quebec among healthcare workers infected with COVID-19 found that 12 weeks after COVID-19 infection, 4 in 10 healthcare workers who were not hospitalized had long COVID. Prevalence was higher among workers who were hospitalized, with almost 7 in 10 experiencing the condition. It is important to see Canadian data as we need to better understand how post-COVID-19 condition is affecting our own population and its subgroups, including children, First Nations, Inuit and Métis peoples, racialized communities, among many others. This is critical in order to better develop and plan for services that effectively address the needs of our diverse population. Of course, we must also be cautious when we interpret this data, as there are limitations. For example, the Quebec study was among health professionals who are not representative of the general population. But the good news is that further studies are currently being undertaken in both Canada and around the world. For example, the Canadian Institutes of Health Research are funding studies that will help increase our understanding of the long-term outcomes of COVID-19. These studies will provide a comprehensive evaluation of early to 2-year outcomes in 2,000 patients with COVID-19 infection and their family, caregivers, as well as important knowledge about risk factors and potential interventions to prevent and treat post-COVID-19 condition, including the effects of vaccination. There is one Canadian initiative in particular I would like to highlight and share with you today. The Public Health Agency and Statistics Canada are collaborating on a population-based survey on chronic symptoms and conditions with a special focus on post-COVID-19 condition. The primary objectives of the survey will be to estimate the prevalence of post-COVID-19 condition in Canada and to provide information on risk factors, symptoms, including severity and duration, and impacts on general health and daily functioning. Invitations to participate in the survey will be mailed out to 100,000 randomly selected Canadians aged 18 years and older across to 10 provinces during 3 waves in April, May, and June of 2022. I seek your support to promote this survey to friends, patients, loved ones, and others, and encourage them to participate should they receive an invitation. This data will help estimate the burden of post-COVID-19 condition in the Canadian population. One of the most important roles of the public health systems is in surveillance and reporting of the health of people in Canada. We use surveillance to understand what is going on across the country, and it helps to develop best practices, guidance, and information exchange. As a part of this network, the Public Health Agency is also exploring potential data sources for surveillance information on post-COVID-19 condition. In spring of 2021, the Canadian Institute of Health Research and the Public Health Agency of Canada co-organized a Best Brains Exchange event where we convened people with lived and living experience of long COVID alongside knowledge and policy leaders to collectively identify what surveillance and research is needed to inform public health action aimed at preventing and managing the impacts of long COVID. The Public Health Agency is also leading and supporting systematic reviews on the global evidence around prevalence, risk factors, and preventive interventions for long COVID. So far, based on evidence reviews, we have learned that some risk factors, including female sex, having experienced severe or critical illness, or having been hospitalized during the acute phase of COVID-19. We will need to continue to gather more data so that we can be better informed and to help us effectively monitor and report on the experiences of people living with post-COVID-19 condition. To the long haulers, I know that what you're going through is challenging on many levels. Recovery from long COVID may not be a linear path, and many individuals report experiencing relapses or periods of increased symptoms. Although some of the symptoms may be mild, some are severe enough to affect one's day-to-day function, ability to work, and overall quality of life. We need to learn more about the best models of care for post-COVID-19 condition. We're working closely with the provincial and territorial health authorities, who are the first stop for clinical care and have seen clinics established in several cities across Canada to support those living with post-COVID-19 condition or long COVID. I want to end with hope. We are learning and taking the advice and experiences from people with lived and living experience of long COVID. This is a lesson we have learned from the early days of the HIV response. Thank you to Realize and all the participants for your work on episodic disabilities over the many years. I wish you all a very successful summit. Thank you. Merci. Miigwech.